Welcome to Survivorship Simplified. This will be episode 1, Lifestyle Beyond Breast Cancer. I am Dr. Joseph Mignone, integrative medicine, medical oncology, and co-founder of SurvivorRx.
And I'm Dr. Todd Robinson. I'm a naturopathic doctor and fellow of the American Board of Naturopathic Oncology, and I am a co-formulator at SurvivorRx.
So Todd, give us a definition of Survivorship Simplified.
Survivorship Simplified. Okay, so if you find yourself to be a cancer survivor in general, it can become pretty complicated. You start asking questions. What should I be doing? What could I be doing to reduce my recurrence risk? What can I be doing to regain my health after treatment? It becomes pretty confusing pretty quickly. And so Survivorship Simplified is going to work on drilling down into those principles, those practices, those ideas that have been shown to really move the needle for people in terms of improving their quality of life, their length of life, and their survivorship period in general.
Thank you. So I'm curious, and I know your story, but they don't. How did you become a naturopath? What led you to this?
So yeah, medicine runs in my family. My grandmother was a nurse. My dad subsequently became a medical doctor. And so when I was growing up, that's the path that I intended to follow. I wanted to go to medical school. Somewhere around when I was about 15, 16, my dad started to express dissatisfaction with where he saw the field of medicine going. He went into medicine wanting to be sort of a small town doctor, the guy who everybody knows and trusts, and he gets to take his knowledge and experience and apply it for the betterment of his patients. And he just saw medicine going in a different direction than that. He felt he was losing his autonomy and his ability to make choices for his patients, and that was being replaced by, like, you have to do this and you have to do this. And there was a lot of insurance influence on how medicine was practiced. And so that led me to maybe think twice about going down that route. And so I started to look around at other professions and other careers, and it was just by happenstance, actually, that I had never even heard of naturopathic medicine or what a naturopathic doctor was. Just literally had a bookstore browsing books, came across a book written by a couple of naturopathic doctors. In the back of it, they had this clear definition of what naturopathic medicine was. It was kind of science-based, but focusing on lifestyle and supplements and exercise and things of that nature. And I was like, oh, this is exactly what I've always wanted to do. And so fast forward, I was at Bastyr University in a year and a half after that, and the rest is history. Naturopathic medicine is a great profession, challenging, but great, because we treat each patient as though they are completely unique. They're an absolute individual. And we use our knowledge and experience, just like my dad always wanted to make suggestions that we feel are kind of the best for that individual in front of us. So,
Yeah, cool. My own path, I went into medicine kind of later in life. I was in college before I decided I wanted to go into medicine. But from there, I knew I wanted to work hands-on with patients. So I went into internal medicine. And it wasn't until I got into oncology that I felt you actually built relationships with patients, long-term relationships, spent a lot of time. It seemed like a lot of the other fields were being rushed. But once I got in there, I realized allopathic medicine is about curing the patient at that time, which I think is great. We have great medicines to take care of the patients when they're really sick, but it didn't do anything to prevent, and it didn't do anything afterwards to keep that problem from coming back. So we know some people say up to 60% of cancers are lifestyle embedded, or lifestyle led to the cancers. But we weren't changing people's lifestyle. So initially I got palliative care trained. I got bored in that. And then afterwards, I realized I wanted to do something before that. Started looking into Dr. Weil, and then realized he had a program out of University of Arizona. So I did that program for 2 years to really get into what we call lifestyle medicine, changing someone's lifestyle to prevent disease, changing someone's lifestyle to prevent recurrences, And that's really what led me into this.
Nice.
So, to continue, I think we want to discuss what our goal in here. And to discuss our goals, I think we came up with 6 pillars of lifestyle medicine that's kind of going to be the focus of our future podcasts.
Hmm.
Why don't you lead us into what the 6 are, and then we'll get into a little bit more detail of what the future episodes will look like.
Yeah, absolutely. So the goal here, of course, is to simplify discussions around survivorship and simplify discussions around how lifestyle can have an impact. And so it's always good, I think, to kind of build a framework for that understanding. And that's where these 6 pillars come to play. And so the first pillar involves diet and nutrition. So that's going to be a whole food, that's going to be functional foods, but that's also going to be nutritional supplements. The second pillar is exercise and fitness. There's a tremendous body of research to show us that pretty much everybody needs to be moving their bodies more. Exercise is a major, major driver for long-term health. And so we'll be exploring various topics in that pillar. Sleep is the third pillar. Sleep is, unfortunately, I think in the modern world, people have a tendency to burn the candle at both ends. Go to bed late, wake up very early, pay very little attention to the quality and quantity of the sleep. So sleep is fundamental for the body's ability to maintain long-term wellness. And so we'll talk a lot about sleep in upcoming episodes. Stress is the fourth pillar. So anyone who's alive feels stressed these days, right? So we'll explore some of the finer details about how stress has an impact on health and what might be done to level out those stress levels. Social connection. Humans is pillar number 5. Humans are social animals by nature. And so nurturing those connections with your friends and family, having outlets for that kind of connection, extremely important. And then pillar number 6 is environmental medicine. Environmental medicine, a little bit of a complicated formal definition, but kind of think of it as those chemicals that we might be exposed to in our day-to-day life. That could be things like alcohol and tobacco. That could be things like chemicals from the foods you eat, microplastics from the foods you eat, chemicals you get exposed to just cleaning the house, etc. And so we'll talk a lot about how that can have an impact on your health.
So I think we'll break them down individually just to give our viewers what kind of topics we'll come up with in the future. I think for each of these topics, I'd like to bring in some science behind them to show why they're useful. For instance, for diet and nutrition, there are a multitude of studies showing survivorship difference based on diets and just based on diets. But we can break down, there are tons of fad diets out there these days.
Mm-hmm. Yep.
I'd like to get down to which ones are proven and which ones aren't. I think a big topic these days are fasting and juicing. I'm really interested in the diversity of people. One diet is for everyone. And, everyone talks about Mediterranean diet, but not everyone likes that diet, and it may not be the best diet for everyone. Yeah, big topic, I think, is the biodiversity of our food system. And each of these we'll be doing blogs with as well. I think mindful eating is overlooked. I think people in the rush and everything, including how they eat. We can talk about processed versus real food, organic versus non-organic. And then we'll end each of the topics with simple tricks to change their life and easy to do in their daily living. Why don't you bring us into the exercise and fitness?
Yeah, absolutely. So it is clear there's a huge body of data that exercise can have a big impact on survivorship, has a big impact on quality of life, has a big impact on risk of cancer recurrence, can have a big impact on some of the lasting side effects of conventional treatment as well. So it's hugely, hugely important to kind of build an optimal exercise program. And so, of course, we'll talk about some of the fads that are out there in the exercise world. Some good, some bad. We'll try and always drill into it and present an evidence-based case about why something may be good or maybe this might be more effective than that kind of thing. We'll definitely explore in detail types of exercise and the quantity that you need to kind of optimize the benefit. And we'll also talk about that in connection with specific goals. Is your goal to, run a 5K? Great. Is your goal to lose a little weight? Great. So we'll connect it to specific goals. A big topic, I think, is protein. I get people who are not eating enough protein. I certainly get a lot of people who are eating way more protein than they actually need. And so we'll talk about protein quality, that kind of thing. Creatine, maybe some other supplements that are popular in the fitness world. We could talk about whether they're good, bad, or indifferent, and especially in relation to what your particular goals and background might be. We'll always want to be providing and wrapping everything up with simple tips about how you can incorporate some of these things in your life. That's the trick with lifestyle medicine. You can't wave a wand and magically be doing everything perfectly across all of these different dimensions. It's like you have to build it one step at a time. And so those simple tricks will help you implement all of these pillars in your own life.
Sleep is another big topic. People don't realize that you detox when you sleep, and it helps with your metabolic health and your immune system. I think we're going to really get into sleep's quality, quantity, biphasic sleep hygiene. There are ways that you can prepare your body to sleep, which I think are extremely important and helpful. I think something overlooked is sleep apnea and how that affects the body. There are questionnaires that you can fill out, and we'll get them online to see if you are at risk for it.
It's overlooked and undertreated. I'm sure you get patients all the time who say, "Oh, I've been diagnosed with sleep apnea." Great. Are you wearing your CPAP? Are you doing this? It's like, no, I hate that thing.
And there are new devices out there.
Yeah.
We don't even need a CPAP anymore. It's just a matter of finding ways to get people to sleep better and sleep apnea to oxygenate at night. There are things you can do. There's simple tricks to help people out. What I think we can also discuss is timing of eating with sleep. People don't realize late meals will disrupt the sleep. Alcohol will disrupt sleep. Watching TV till late at night will disrupt sleep. So all those things that people do all the time, we'll kind of come up with ways to just modify a little bit can make a big difference.
That's a famous line from what is that? A Christmas Carol. It's like when the ghosts are there, it's like you're a bit of bread or cheese. You're like, that idea that what you eat can impact your sleep, and how you dream is as old as a Christmas Carol. All right. So one of the pillars is stress, and we'll absolutely explore in detail the impact that stress can have on survivorship. Stress seems ever present these days. And so I think it's important for people to understand the impact that stress has on the body, and also to understand how to assess or figure out if you yourself are in fact stressed. I get it all the time where people will say, no, I'm not really that stressed. But after talking to them, maybe giving them a questionnaire or doing some sort of assessment, it's like, you are saying one thing, your body is saying something different. Let's connect those dots and help you deal with it. So we'll go into the short-term and the long-term effects of stress. We'll talk about some of the physiologic impacts of stress, like how what the HPA axis is and how stress can impact that. We'll talk about some of those assessments, whether they're questionnaires or some sort of like physical exam, heart rate variability assessment. We'll definitely give tips on ways to deal with everyday stress, talk about some supplements that might help, breathing exercises, and other techniques to help get that stress under control. And hopefully that will always be connected to some kind of objective assessment, like, oh, my questionnaire score is getting better, or my heart rate variability is getting better, or my resting heart rate's getting better. And we'll definitely provide a lot of those simple tricks and how you can incorporate it into your own life.
So I just want everyone to remember that all these 6 pillars overlap. So for the social connection, if you don't have good social connections, it may lead to more stress, worsening sleep, worsening, dietary choices. We are social beings, and we are meant to be out there socializing with others. There are multiple different types of social connections. People find purpose in church. People find purpose in volunteering. People find purpose in, just different activities that they enjoy, that they can find others to enjoy with. And I think that is a big part of relieving stress and overall survivorship. I find people in practice that are isolated or in bad relationships tend tend to do worse. They tend to have more side effects, tend to do worse overall, tend to not care if they do worse, which I think is extremely important because I think positive attitude goes a long way in treatment, mind over body type techniques.
Mhm.
Um, so, positive outlook helps a lot. So I think there's certain areas where counseling is extremely important. And I think we can give some tricks on when to look for help, what kind of social interactions to look for, how to get more involved. Um, there's some great people that started great organizations from difficult situations. And, I'm not saying everyone needs to go out in there and start, but, maybe a little volunteering or just talking to someone
Mhm.
goes a long way.
Great. And then the last pillar is environmental medicine. Environmental medicine, I think, has permeated uh, or the culture more than it had 10, 15, 20 years ago. So environmental medicine is the idea of the exposure to those chemicals and those substances in our day-to-day life that might interfere with optimum body function. There's a concept in environmental medicine called total body burden, which we will talk about in detail, but essentially it's the totality of sort of these chemicals that don't belong in your body and how much of that there is, whether it's BPA or microplastics or heavy metals. So we'll explore all of those concepts, provide some tips about how to increase. So the sort of basic formula is if you want to lower your total body burden, you have to decrease what goes in and increase what comes out. And so we'll talk about some of the science behind what actually moves the needle there. How can we decrease what goes in? How can we increase what comes out to reduce that total body burden? Of course, there'll always be simple tricks and tips that we'll tie it back to techniques. And in this area, we'll definitely bring up some apps or products that might help you in your day to day. There's so many good. Again, this is another reason why I feel like it's sort of permeated our culture more. It's like there are apps on your phone where you can go to the grocery store and scan a product, and we'll kind of give you a score about whether it's got chemicals in there you might not want to be eating or feeding your family. So we'll talk about those in detail. And I think another thing that I would love to talk about, I think it's really, really important, is um, the idea that, and this is true across all pillars, we want to achieve balance with everything. It's very, very easy to go down that rabbit hole where it's like, I literally can't eat anything. I'm afraid of everything because of microplastics or heavy metals. And that creates a bunch of stress. And then that interferes with your ability to eat healthfully and that sort of thing. So with all of these pillars, balance is always going to be, I think balance is always going to be a theme that we're going to bring up. We're going to try and tie it into the science, going to try and present a balanced and practical approach. And there may be times when we disagree on things, and I hope that we'll kind of lean into that and have a fruitful discussion about the differences of opinion.
So thank you again for joining us today. So we look forward to episode 2, the science behind diet and breast cancer.
It's going to be a good one.